Well, good evening, Meg and David. Many of the veterans who served at K2 are getting sick, dying young, often from cancer. This is being compared to Agent Orange, but on a smaller scale. It's believed around 7,000 served at K2, but not all service members are accounted for. Some could be here in mid-Michigan and not even know to get themselves screened.
Immediately upon arrival, people were recognizing this was not a safe place.
Green water, sinkholes, radiation, and reports of black goo. This is Karsh Khanabad Air Base, K2.
I don't know what they possibly could have done to make that place safe.
Who knows what you're breathing?
Because K2 had a history.
This base had been the site of a missile explosion in 1993. Depleted uranium was scattered across the base.
Before that, the Russians used the base to store chemical weapons.
Nerve agents, blister agents, blood agents, mustard agents.
Service members like Derek Blumke of Northern Michigan and Scott Welsh of Kansas City didn't question the danger signs all around them. K2 is in Uzbekistan, close to Afghanistan. K2 was used as a military launch pad after 9/11.
We knew what we were doing for our country. The mission was rewarding. We were proud to be there.
You had a mission to do. You didn't think about it then, but now that we're back and we're all coming down with everything, you're thinking, oh, that was something to think about.
And the U.S. government actually did think about it, conducting an environmental assessment in November 2001, finding a leaking underground Soviet fuel system, asbestos and uranium in the soil. The solution? Literally a cover-up, showering the radioactive site with dirt.
They put a layer of rocks over top of that, and that was supposed to seal the radiation. When it rained, all the chemicals from that decontamination site flowed down into the tent city.
Do you guys know what they should have done instead?
Got us out of there. There's radiation. We should leave.
But soldiers stayed at K2 until 2005.
We knew on November 6th of 2001 that this base is bad.
The 2001 assessment advised soldiers there were no health consequences.
I had muscle twitches in one of my arms, and I'm finding that's one of the symptoms of nerve agent exposure.
Disc degeneration, headaches, daily headaches, skin rashes, kidney stones. I get kidney stones constantly.
And Welsh survived thyroid cancer. Many K2 vets can't say the same.
In one unit, they had 2 folks who have died of brain cancer and a third who is currently fighting brain cancer.
At least 360 K2 cancer patients have been identified by this Facebook group. One of the founders died of cancer.
I spent 3 or 4 days just in shock. Every few minutes it seemed a new person was joining, a new person was self-identifying with cancer. We've got a 2015 study showing that there's a 5x increased prevalence of cancers of K2 veterans compared to service members deployed to Korea. We're looking at a 10 to 15% cancer rate.
Blumke says the government hasn't reached out to all K2 service members.
Does it feel like this whole thing is being ignored?
I think it got ignored until December 19th of 2019.
That's when a news article first broke the K2 story open, and when Blumke made the connection of his health problems to his service. Now, he just returned from D.C., calling for hearings, looking to the VA and Congress for accountability.
Congress is taking this quite seriously because they don't want this to drag out. Like they're upset that this happened. They're ashamed that this happened, and they want these people and their families taken care of immediately.
Blumke wants Veteran Affairs to reach out to K2 veterans and ensure their screenings and health issues will be covered. VA Secretary Robert Wilkie says they're here to help.
I want all veterans who've been there and who feel they need to see us to come forward. We are continuing to investigate. This is not your grandfather's VA where the paperwork's going to last 10 years. We have people ready to help, and that's the message that I give to K2.
A number of K2 veterans, including Scott Welsh from the story, will testify before the House Oversight Committee Thursday. If you have information on veterans who served at this base and are concerned about their health, give us a call or send us an email. Live in studio, Scott Walczek, WNEL TV 5.